into labour can be a really scary thought, as it is known that labour can be very painful. But unfortunately, as a midwife, we can't tell you how long your labour is going to be and how long you're going to experience this pain for. I always say to women before discussing pain relief that it's not about coping with the pain, it's about how long you can cope with the pain for, because some labours can be very long, especially if this is your first pregnancy. Between being exhausted and being in a lot of pain, it can be really difficult. So I just want you to know that there's nothing wrong with having pain relief during your labour. Of course, everyone is very different and everyone's pain threshold is completely different, but I recommend that you make yourself aware of the pain relief offered to you. So if you are in labour and require any pain relief, you know what you'd like and what is best suited to you. It is also a good idea for your birthing partner to be aware of the pain relief options available to you, because if you do require any pain relief, they'll be able to help you, listen to you and support and be there for you. So I'm going to start with the more natural pain relief methods that are available to you, and then go on to discuss the more stronger pain relief that we offer to you during your labour. So the first thing is try to relax and keep calm. A lot of women fear labour, and this can impact your labour by releasing adrenaline, which can affect the hormone oxytocin, as this will slow down. Oxytocin is an essential hormone during your labour, as this will stimulate your contractions to dilate your cervix. To be relaxed and keep calm during your labour, it is recommended to breathe through your contractions and do slow rhythmic breathing. This will help you to focus on your contractions and feel more relaxed during your labour. If you are unsure on how to do this, you could always book onto a local antenatal class in your local area, as they sometimes discuss different relaxation and breathing techniques, and this could help you. Hypnobirthing is also very popular, as they discuss different mindfulness and relaxation techniques that can be used during your labour and birth. And what's good is that you can still use your breathing techniques with other pain relief that is offered to you during your labour. And you could also try making the lights dimmed in your labour room, having battery operated candles, or even having some relaxing music in the background, as this will help to relax and calm you. Trying different birth positions can also help with the pain during labour, especially upright positions, as this will help with gravity to bring your baby down into the pelvis. Using a birthing ball can also help, maybe leaning forward, doing swaying and rocking motions, as this can help ease the pain and help you to relax. A very popular pain relief method is a water birth, as warm water can soothe the pain and it can help you to support your body into different positions, and it also doesn't have any negative impact on baby. However, unfortunately with a water birth you can't really have any other pain relief such as diamorphine, pethidine, epidural or remifentanil, etc. And also, if you're classified as high risk and need a hormone drip during your labour to stimulate your contractions, then you can't have a water birth at this time either. And just to add, you can have gas and air when you're in the water. So another pain relief method is a TENS machine, and I found these to be quite useful on women, especially in the early stages of labour, before the contractions become stronger and longer and more frequent. The TENS machine can help with pain in your lower back, especially during labour, which is quite common, but unfortunately a lot of the hospitals don't provide them, so I probably would invest in one before you go into labour. If you don't know what a TENS machine is, it's just a small device connected to wires with electrodes at the end that are applied to your back with sticky pads, and you provide yourself with a small amount of current through the electrodes. It is believed to work by stimulating your body to produce more endorphins, which is a natural painkiller your body produces. Another common pain relief that most women go for during labour is gas and air, also known as Entonox, which is made up of 50% oxygen and 50% nitrous oxide. And what's good with this is that it can be used throughout your whole labour. It is best used at the start of the contraction, either using a small mouthpiece or a mask, and you just take a slow big deep breath in and then out, and continue to do this until the contraction has ended. It's also important to be aware that if you do use this pain relief, it's important to take big deep breaths of normal air in between your contractions, because it can make you feel lightheaded, dizzy and sick. And it's also important to keep hydrated, as the gas and air can make your mouth very dry. A slightly stronger pain relief that will be offered to you is an opioid injection into your thigh, either called pethidine or diamorphine. Different hospitals use different injections, so do ask your midwife which one will be offered to you at your local hospital, but both are very similar. This injection will take the edge off of your contractions, and they usually start working after 20 minutes following the injection and can give you pain relief for up to 4 hours. The side effects of these injections is that it can make you feel nauseous. However, we usually give you an anti-sickness injection with the pain relief to prevent this. And it's also important to remember that this medication can cross the placenta to baby and make baby also very sleepy. So we don't usually recommend it in the later stages of labour, as it may be the baby needs help with the breathing following the delivery. And as it crosses the placenta, it can also affect breastfeeding in the early stages following birth. Another opioid that some hospitals offer is remifentanil, and this is a very strong pain relief that goes through a drip either into your arm or your hand that can only be given by an anaesthetist. This is connected to a pump that is controlled by yourself, and you press the button when you feel a contraction come in, but there is a safety mechanism on the pump so you can't overdose yourself. The benefits of this medication is that it gives you quick pain relief, as you will feel the benefit within 20 seconds of pressing it, and it leaves your body quite quickly so the side effects don't last long. But unfortunately with this medication, it can make you feel very sleepy and tired, and can sometimes even make you feel breathless. So the midwife will make sure that you have a small clip on your finger so we can observe your oxygen saturations at all times, and it may be that you need some oxygen to help with your breathing. And also, like pethidine, the remifentanil can cross the placenta and also make baby sleepy, but this medication isn't long lasting and wears off quite quickly. And the last pain relief I want to talk to you about is an epidural, and this is an anaesthetic that only an anaesthetist can give you. So essentially it's a small tube that's inserted into your back to numb certain nerves that carry pain impulses from your birth canal to your brain. The aim of an epidural is to give you good pain relief, and it usually removes pain and feeling from the waist down. If you do decide to have an epidural, you will first discuss this with an anaesthetist, and they will go through all the benefits and risks with you before you go through with it. If you do decide to have an epidural, you'll have fluid run through a drip into either your hand or your arm, as the medication for an epidural can lower your blood pressure, but the fluid should help with this. And we will also monitor your blood pressure very closely during your labour. To have the epidural inserted, the midwife will help you to get into a position on the bed. It's usually in a curled position where we place a pillow just here and then you curl over it and make sure that your shoulders are relaxed. And it's important that you stay as still as possible for this procedure. We will then clean your back with antiseptic spray and make sure that everything is sterile before the anaesthetist starts siting the epidural. The anaesthetist will then numb the area with local anaesthetic before inserting a needle to insert a small tube into your back, and this is usually where the medication goes through. And then the epidural will start usually working within 30 minutes, and the anaesthetist will discuss with you how you can use the epidural throughout your labour, as it is patient controlled, but again you can't overdose as there is a safety mechanism on the pump. Following an epidural, you may notice your legs feeling heavy, you may feel itchy, and you can also be quite shaky, and these are very common side effects. Having an epidural can also make the second stage of your labour longer, as it can slow down the feedback to your brain to produce oxytocin, which can slightly increase the chance of you needing assisted birth, such as a von 2s or a forceps to help deliver baby. But if you have an epidural, we usually give you more time for the baby's head to come down into the pelvis, as long as baby isn't showing any signs of distress. And sometimes this can reduce the chances of you having an instrumental delivery. And also after an epidural, you'll find it more difficult to wee because it is likely that you won't have the sensation to go to the toilet, as you're likely to be numb from the waist down. So we usually recommend that you have a catheter during your labour if you have an epidural. Other side effects following an epidural include having headaches, having pins and needles, or maybe even feeling sore for a few days after. But again, the anaesthetist will discuss all of this with you before you have the epidural, and we'll also discuss after having the epidural if you have any concerns and what you need to do if you do have any concerns. I just want to also mention that if you do have any strong pain relief, such as an epidural or remifentanil, or if you're high risk in any way, then your baby will need to be more closely monitored during your labour. And so that brings me to the end of the video. Thank you so much for watching. I really hope you've gained something from this video and it helps for when you do go into labour. But if you do have any questions, then please let me know in the comments, and if you could please subscribe, it really does mean a lot to me.